Hello everyone, I am Shahzada Babarshir and I am gonna discuss about the critical analysis of the NSW Health, Aboriginal Maternal and Infant Health Service. It is a key initiative aimed at improving the health outcomes of Aboriginal and Torres Strait Islander mothers and their infants. It provides culturally appropriate maternal and infant health services addressing both the social and clinical aspects of healthcare to enhance the well-being of Aboriginal communities. The NSW Health Aboriginal Maternal and Infant Health Service plays a vital role in addressing the unique healthcare needs of the Aboriginal women and their infants. Through its focus on cultural safety and its efforts to address key social determinants of health, the program makes a substantial contribution to improving health outcomes for Aboriginal communities. First one is cultural safety of the program for First Nation individuals. Cultural safety is a critical aspect of healthcare services, particularly when working with Aboriginal and Torres Strait Islander communities. It refers to an environment where individuals feel safe, free from discrimination, and respected in terms of their cultural identity, beliefs, and practices. The concept extends beyond cultural awareness or competence and involves active removal of power imbalances and institutionalized discrimination that affect healthcare outcomes. In the case, key elements contributing to the program's cultural safety. Employment of Aboriginal health workers. One of the primary ways the AMIHS fosters cultural safety is by employing Aboriginal health workers who act as cultural brokers between the healthcare system and Aboriginal community. These workers play a crucial role in building trust, communicating effectively, and ensuring that cultural needs are respected in medical settings. Culture community engagement. The program places emphasis on working in partnership with local Aboriginal communities to co-design services that are responsive to their needs. This collaborative approach ensures that program remains relevant and culturally safe by acknowledging and incorporating community perspectives. There are some challenges like, however, while AMIHS has made strides in improving cultural safety, some challenges remain. There is variability in the implementation of cultural safety practices across different regions in NSW, particularly in rural and remote areas. Additionally, the program sometimes struggles with staffing shortages, particularly in terms of Aboriginal health workers, which can limit its cultural responsiveness. Social determinants of health addressed within the program. The social determinants of the health are the non-medical factors that influence health outcomes, including conditions in which people are born, grow, live, work, and age. For Aboriginal and Torres Strait Islander communities, these are the social determinants. The legacy of colonization, social disadvantage, intergenerational trauma, and systemic discrimination continues to profoundly affect health outcomes. Programs like AMIHS are designed to address some of these determinants by providing not only health care but also addressing the broader socio-economic factors that influence health. Access to health care. One of the most important social determinants AMIHS addresses is access to health care. Aboriginal communities, particularly those in rural and remote areas, often face challenges in accessing adequate maternal and infant health services. The AMIHS programs extends its services to these regions, ensuring that Aboriginal women have access to culturally appropriate prenatal and postnatal care, thus reducing geographical barriers to healthcare access. Education and health literacy. The program emphasizes health education and the development of health literacy among Aboriginal mothers through counseling workshops and ongoing support, the program educates mother about infant nutrition, breastfeeding, immunization, and general child health. By empowering mothers with knowledge and resources, this program helps to mitigate one of the key social determinants of poor health, lack of health literacy. Economic stability and employment. Economic disadvantage is a critical social determinant that significantly affects Aboriginal communities. Through the support of AHWS and midwives, the program helps young Aboriginal mothers navigate socio-economic challenges such as accessing social services, housing, and employment opportunities. While the program does not directly assess economic stability, family and social support. AMIHS acknowledged the importance of social and family support in promoting healthcare, pregnancies, and births. Many Aboriginal women face challenges related to the social isolation or strained family relationship, often linked to broader issues of displacement and disempowerment. The program fosters family involvement, encouraging the participation of extended family member partners and other support workers networks in maternal care. This approach strengthens social support and important determinants of both mental and physical health. Addressing intergenerational trauma. A significant aspect of program's work is its role in addressing the effects of intergenerational trauma, which continues to impact Aboriginal families. By providing trauma-informed care, AMIHS acknowledges the role that historical trauma plays in shaping health behaviors and outcomes. The focus on emotional and mental well-being helps mitigate the ongoing effects of colonization, discrimination, and loss of cultural identity, which are central to the health and well-being of Aboriginal people. While the program makes notable efforts to address the social determinants of health, there are areas that could be improved, particularly in terms of addressing structural inequalities like poverty and housing insecurity, which continue to affect Aboriginal communities. Recommendation to improve the program. While AMIHS has made significant strides in improving the health outcome for Aboriginal mothers and their infant, there are several areas where the program could be enhanced. These include expansion of services in remote areas, increased investment in Aboriginal health workers, integration of traditional health practices, greater focus on structural determinants of health, enhanced monitoring and evaluation, expansion of services in remote areas. One of the challenges that program faces is its ability to reach women in extremely remote areas. Increased investment in Aboriginal health workers. A critical aspect of program's success lies in the presence of Aboriginal health workers who ensure cultural safety and community trust. However, there are ongoing challenges related to recruiting and returning AHWS, particularly in remote areas. Increased investment in training, employment opportunities, and incentive for AHWS. Integration of traditional health practices. While the program attempts to incorporate traditional health practices where possible, this could be expanded further. Increased collaboration with traditional healers and elders could enhance the cultural safety of the program. Greater focus on structural determinants of the health. While AMIHS addresses some social determinants, there is scope to expand its focus on structural determinants of health, particularly housing, employment, and education. Partnering with other government, non-government organizations could allow the program to offer more comprehensive support to Aboriginal